Hi, I'm Anthony Newbold. Welcome to A Closer Look. My guest this week, Minister of Health, Dr. Duane Sands. Dr. Sands, welcome again to the show.
It is a pleasure to be here. Good day.
Yes, thank you again for coming. Coronavirus, COVID-19 they call it. Everybody's up and down about it, including our government, because we're concerned. I understand you released some report recently.
We have been trying to balance the truth from the fake news. What is interesting about this epidemic, this public health emergency of international concern, is that while it is a serious public health challenge, it has been largely confined to the People's Republic of China, with more than 99% of the 70,000 cases and the overwhelming majority of the 1,700 deaths. But there has been so much misinformation and disinformation that the world has gone into a panic.
Yeah.
So we have tried as a government to make decisions that would protect the interests of the people of the Bahamas and to ensure, first of all, that we limited the possibility of a case of COVID-19 being imported to the Bahamas, but also to make sure that we knew how to manage such a case. Heaven forbid it should arrive on our shores.
So what you released was what I understand is called a preparedness plan?
Correct. So we wanted to make sure that every single part of the response, whether that's police, customs, immigration, doctors, nurses, the taxi drivers, etc., knew what their roles should be in the event of a suspected case, what you should do, how you should do it, when you should do it, who you should call.
That what I call it interagency collaboration, has that moved as smoothly as you expected?
It has been incredibly smooth. When I look at the buy-in at the level from the Prime Minister through the multiple ministers, the Attorney General, the Minister of Transport, Financial Affairs and Immigration, they have all bought into, and all of the relevant agency heads have similarly bought into participating, collaborating. Tourism has been working with the cruise lines, the airlines, etc., all to make sure that this archipelago, where we have some 400,000 people whose livelihood and welfare is protected by the government of the Bahamas. We want to make sure that everybody knows their role.
World community, WHO, World Health Organization, is everybody satisfied that the source of this virus has been identified as best as it could be?
That's a very, very good question. We believe that this virus, which originated likely from an animal source, then jumped into humans and is now being spread by human to human contact. We have seen unprecedented public health interventions by the Chinese government. Never before in the history of man have you seen the lockdown of some 50 million people. Trains, cars, buses, everything shut down. You can't go in, you can't get out. And that has, at least temporarily, we believe, halted the progression or the spread. So if you look at the 70,000 cases confirmed of COVID-19, the overwhelming majority of them are in China, mainland China, and except for the single cruise ship, which was docked outside of Japan, and they have some 350 or so cases. There's no single country with more than 100 cases.
People have been quarantined. Do we have any? And where would you keep them?
We had persons quarantined. We took the position that any Bahamian resident or citizen coming home, having been in China within 20 days, would be quarantined for a total of 14 days to make sure that we got past the incubation period of the virus. We had as many as 16 people quarantined. Everybody has completed their quarantine as of today.
Okay. Everyone accepts that there's danger involved with this virus. How concerned are you and the government that we could possibly get somebody who's been affected?
I think if you listen to the utterances of the various public health experts, whether you're talking about Dr. Tedros from the World Health Organization, Dr. Etienne from PAHO, Dr. Fauci from the NIH, or our regional leaders, our Chief Medical Officer, Dr. Pearl McMillan, there is certainly a possibility that every country may ultimately see a case or several cases. At this point, it's difficult to determine whether the feared Armageddon-like scenario could possibly develop. And that is why we have to collaborate, to cooperate, to share information. It is one of the reasons why it is so important not to share unverified fake news.
Yeah. You had to prepare, obviously, and having a preparedness plan is more than just putting it on paper. That means you got to get your team ready. What does that do to your other health plans?
Well, it allowed us to see the gaps. Bear in mind that there are two concurrent public health emergencies of international concern. One is coronavirus, or COVID-19. The second is Ebola. So the WHO historically has only had 6 public health emergencies of international concern since 2009 or thereabout. They would have responded to SARS, they would have responded to the outbreak of measles and so on and so forth. Ebola has created such a warning twice. So almost 6 months ago, the world would have been alerted about Ebola in the Democratic Republic of Congo. What we realized is that this exercise forced us to look critically at how prepared we were in Nassau, in Abaco, in Grand Bahama, in the rest of the Family Islands, given our porous borders. We have multiple aerodromes or airports, we have seaports, we have people coming in here clandestinely. So this allowed us to look, to be honest with ourselves, and I believe the exercise has caused us to strengthen our preparedness.
You talk about being prepared. Nurses, doctors, ancillary staff. Let's start with the doctors. You're still having some challenge with your doctors.
We have, and this is an historic issue. Bear in mind that we have taken the position that a problem which has been kicked down the road for many years needed to be resolved. Let me very quickly give you a snapshot. The Bahamas used to send 2 or 3 students to the UWI annually. They would then come back, do an internship at Princess Margaret Hospital, then spend a number of years in the hospital as a senior house officer, then ultimately go off and train and come back. Over time, that number from 2 went to 5 and then 10, until it got as high as 70 doctors a year.
That's an interesting number. Let me take a break, think about that, and we're going to talk about it when we come back. And we'll be back with Dr. Sands, the Minister of Health, after this. Welcome back to A Closer Look. Anthony Newbold speaking with Dr. Duane Sands. He's the Minister of Health. You're telling me about the situation with the doctors.
So over time, since the government of the Bahamas provides scholarships for aspiring, talented young Bahamians, it got to the point where as many as 60 or 70 young persons were given subventions or scholarships to attend the University of the West Indies at their 3 campuses in Trinidad, Barbados, and Jamaica. The problem is that PMH is only accredited to train 30 interns. Young doctors, after they finish medical school, are now just prepared to learn the art and science of medicine. And they require a period of apprenticeship, residency training program in order to learn the specialties of surgery, obstetrics, pediatrics, psychiatry, what have you. What we have done, because of our inability as a country to provide the capacity to train, is we have locked hundreds, some 350 young doctors into a life of perpetual junior doctorship.
Yeah.
And that has been an incredibly frustrating phenomenon. What we have done is we have taken an holistic approach now to solve this problem. This came to a head this year when we had maxed out on the number of slots available for senior house officers. I can tell you as of today, every single person who has completed their internship in July of 2019 has been hired by the government of the Bahamas, many of them to work in the Public Hospital Authority, but a significant number to work now in the community clinics. And what we intend to do is to create a scenario so that in perpetuity, anybody wishing to become a doctor who has been supported by the government of the Bahamas will have an opportunity to train in the public hospital, but they spend some time, they train, they are independently qualified, and they leave.
That means because you have no place for them, or you don't have the capacity to train them. You've had as many as 70 training with the UWI. Are you going to cut that down?
We've cut it down to 10
Okay.
this year, will be 10 next year, and then 25 each subsequent year. What we realize is that we have disproportionately supported people wanting to become medical doctors. We don't have enough dentists, we don't have enough veterinarians, we don't have enough pharmacists, we don't have enough occupational therapists, speech therapists. And so to those persons listening today, if you want a rewarding career in the health services in the Bahamas, feel free. We are quite prepared to give you a scholarship. But we need, in order to win the World Series or the Super Bowl, you need more than just a quarterback. You need a full team. Mm-hmm. So not just doctors and nurses, but the entire gamut. And we have shortages all the way around, to the point where at our mini hospitals in Exuma and Abaco, many services cannot be provided because we simply do not have the local expertise.
Yeah. Talking about nurses, what's the situation with the nurses? Perpetual shortage.
Again, I think we took our eye off the ball. When I say we, successive administrations took their eye off the ball. We didn't realize that the demand for talented Bahamian nurses into more mature jurisdictions like the United States, Great Britain, and Canada would result in a siphon. And so as quickly as they were trained, they would be pulled into North America. We have begun now to stem that flow, and we have done a few things in order to improve the terms and conditions of service for nurses, including giving a scarcity allowance, but also improving their perception that the employer, meaning the government of the Bahamas, cares about their personal advancement, their continuing nursing education opportunities, advancement in their fields, etc. And so what we have seen has been an increase in the number of nurses in the Bahamas over the last 2 years.
Yeah, what we are seeing really, this is a perpetual management problem that you will have. You just got to keep managing it properly.
What we need to do is to claim it, acknowledge that there's a problem, to understand that things have changed, and that people, particularly young women who have traditionally gone into nursing disproportionately, have choices.
Yeah.
So let us acknowledge that things have changed and provide some types of incentives to keep people in that noble profession.
You seem certainly to be making progress with your physical environment. You're doing some things over there at PMH.
I'm very proud of what we've been able to do with very limited resources. We have had a chronic problem with shortage of space or beds, in part due to a huge number of boarders that have taken as much as almost 10% of our bed space. So we are moving those boarders out, but we have been renovating spaces in order to have additional beds for patients. But the most significant project, I believe, is the renovation and improvement of accident and emergency. Ground zero. That's where people speak usually quite passionately about their experience at Princess Margaret Hospital.
They certainly do. And I got to ask you this question because one of our online viewers said this. Why are so many persons, many of whom are immigrants, still flooding the PMH for service and pay nothing? I was waiting with 17 other persons in A&E, and only 5 Bahamian names were called. I know that's something you've heard before, so.
I don't know. I've heard those complaints or those allegations. I'm not sure that there's a whole lot of validity to it.
Okay.
The overwhelming majority of people that come to Princess Margaret Hospital do not pay. Okay. So some 87% of people that come to Princess Margaret Hospital do not pay. And if you look at the emergency room where we see almost 60,000 patients, yeah. The average person that comes to the emergency room, the average person pays less than $5.
Yeah. So you're talking about looking at remaining in deficit. When are those works expected to be completed that you're going on?
So we're
now?
8 weeks into a 40-week course, construction course.
Yeah.
And then we have a second phase. This is tied to projects at South Beach and Elizabeth Estates. And when we're done, we will have a renovated accident emergency with improved skills, including service skills, soft skills for our people, as well as urgent care facilities at South Beach and Elizabeth Estates.
The renovations are good. Is there any chance at all that there will be a new hospital?
Yes.
Okay.
I believe that we have made it very clear, certainly in Grand Bahama, that notwithstanding the existential need to have a facility through which we will manage the hurricane season of 2020 and perhaps 2021, that the Rand Memorial Hospital has outlived its useful life. So definitely a new hospital in Grand Bahama. At Princess Margaret Hospital, it's a bit more nuanced. We would have invested almost $100 million into the critical care block, and we don't plan on abandoning that facility. What we need is to add additional renovated or new spaces. When I say renovate, I'm not talking about take an old building and put a little paint and putty. I'm talking about tear it down and rebuild. So the next tower will be a new emergency room, a new maternal child health building, and a new imaging suite.
We'll talk about that some more, but we've got to take this final break, and we'll be back with Dr. Duane Sands, the Minister of Health, after this. Welcome back to A Closer Look. Anthony Newboldham speaking with Dr. Duane Sands, the Minister of Health, talking about the RAND, talking about PMH, but talk some more about the RAND and what's going on in Freeport.
Remember, the RAND was flooded with black water.
Yeah.
Sewer contaminated water that got everywhere. This made about 75% of the facility unusable. What we have had to do is rip out everything that was contaminated, and that is now being restored in partnership with Carnival, with Direct Relief, with Samaritan's Purse, with a number of non-governmental organizations, partners that have really been working with us and for whom we're incredibly grateful. We expect that remediation should be completed by the end of March 2020. But even when we get back into that facility, there are plans now to identify a proper new Rand Memorial Hospital, which is climate resilient. We have to define how big it should be, what services should be there, how high off the ground it should be, and it would be impossible to do that between now and June 2020.
Yeah. So, and again, you're talking about a new facility, which you're talking about a new location.
New location, new services. There's no oncology or cancer services provided in Grand Bahama now. There's no heart services provided in Grand Bahama. This is our second city. So we now need to conceive and design a facility that will serve the people of the Northern Bahamas for the next generation and perhaps beyond.
Yeah. And this is a matter of curiosity. I'm sure there must be a maintenance team at both facilities. How much maintenance can they actually do?
Another excellent question. You're talking about facilities that were built in the 1950s.
Yeah.
And we have put all the putty and paint and plugged the holes that we could. These entities were designed for a quieter, slower time. And they have given us good service, and I think it's time to retire them.
Yeah. What's the position with national health insurance as we're talking about health and the ability to pay or not pay, as the case may be? What's the position right now as we speak?
As of this month, there are some 77,000 Bahamians who are enrolled and participating in national health insurance, and they are benefiting from primary care services. What we would like to do is to expand that number, but also increase the services that are provided through NHI. The satisfaction rate is greater than 93%. People find that they prefer to go to a private doctor as opposed to waiting in a clinic. What we now need to do is to identify the funding to provide catastrophic care services. What do I mean by that? It's all well and good to be diagnosed with a problem, but let's say you need open heart surgery.
Yeah.
Let's say you need dialysis. What we need to do, and what we have not yet done, is to identify a sustainable funding source in order to allow those services to be provided not through the PHA itself or through the consolidated fund, but through NHI or National Health Insurance.
Talking about funding, what are you doing? There's some thought about public-private partnership initiative being used to do some of these things you need done.
Yes, we recognize that the government of the Bahamas, the people of the Bahamas, don't have the financial headroom to take on huge amounts of debt. And so the model of a carefully considered, appropriately planned public-private partnership in order to get these capital projects done. So let's say the hospital at Grand Bahama would be $100 million, and the completion of Princess Margaret Hospital, $400 million. We would have said in our pledging conference that the total spend on health could be anywhere between 600 and 700 million. So the idea of public-private partnerships to get these things done, and then a sustainable financing mechanism in order to ensure that that debt is repaid over time.
And this is something that you will pursue.
We have had a number of offers. One of them was made during the pledging conference, but many others have been put on the table. We have made no decisions, and any decision that we make will be in the best interest of the people of the Bahamas, and we have no interest in hijacking the future of our people and our children in particular over a deal that was not in the best interest.
Coming out of Duane as well, and all these challenges which remain, Duane has just exacerbated them. You think you got a handle on what's going on with your health care?
Duane forced us to step up our game. And if you ask whether we were ready for Duane, the answer is probably not. But subsequent to Duane, I think as we move forward, this could indeed be, as a people, our finest hour. How we respond in times of challenge, how we respond to the needs of our entire population. We've had to dig deep. We've had to rely on each other. We've had to work together. And I believe that it has forced us to get closer as a people and to not sweat the small stuff, but to look critically at what's important and to get it done.
Thank you, Dr. Sands, for coming and sitting with me.
It's a pleasure to be here, and I really appreciate the opportunity to talk to you and to the people of the Bahamas.
And we will invite you back again.
Thank you.
And thank you for watching A Closer Look. Remember, you can also watch us on YouTube and on Facebook.